Assistant Professor in Health Economics, with the kind request that we keep to the time limit allocated. Thank you. Dear friends, welcome to the 5th session of this Health World, the 21st Annual Conference Health World. We'll be talking about the role of health technology assessment in the pricing and reimbursement process. We have talked about the role of health technology assessment. We know it's a wider terminology that examines various factors, aiming at showcasing the value of a technology in health. We will be focusing today mostly on pricing and reimbursement. We have the pleasure of being joined primarily by Mrs. Flora Bacopoulou, who is chair of the Adolescent Healthcare, or rather chair of the Health Technology Assessment Committee of the Hellenic Ministry of Health. Yfantopoulos, Professor Emeritus of Health Economics, and Assistant Professor Kostas Athanasakis in Health Economics and Health Technology Assessment. Mrs. Bacopoulou, to cut a long story short, you have the floor. I'm assuming you will be talking to us about the situation today regarding the Evaluation Committee. Thank you very much for this kind invitation. If I may have control over my slides. I would like to share with you some recent data from the committee's operation. It is an 11-member committee. You can see the people comprising the committee. We have the subcommittee of evaluation for the exceptional requests. It is a 5-member committee. Now, the most recent data pertain to 776 new applications received by the committee as of January, or rather from January 2020 until today. I should like to remind you that it is when the new committee was established. Despite the backlog of 106 requests and the 776 new applications, today we have very few files still remaining to be assessed. It is somewhere around 50, so the productivity of this committee is ever increasing. From the first quarter of 2020, when we took over as the committee, the assessment pertained to 15 files per month. Essentially today we have doubled our efficiency to over 28 evaluations per month. You can see here the course of the 493 drugs, barring generics, that were assessed. You see out of 493, 375 drugs have been referred directly to the negotiations committee. 100 have been referred directly to the Minister for Health, whereas the remaining have received a negative no approval. You can see here that we have a team of 82 external partners who are all doctors. We are active not only at the national level, but as of recent, we have seen activity in the European level. You all know that as of January 2021 or December 2021, EU regulation of health technology assessment was approved. It was published in 2021. The first steps in this regulation was to set up the coordination group. An invitation was also dispatched to the stakeholders to express their interest in order to set up the stakeholder network. In April 2022, representatives were appointed with the European coordinating team for medical technical, Mrs. Ioannou and Nigli, and for drugs, Mrs. Kani and myself. The HTA regulation is expected in the first 3 years to function in a preparatory form. As we said, the coordination group has been set up. Other steps, preparatory steps, are to be expected, with the ultimate aim being in 2025 first to assess and evaluate cancer drugs the next 3 years until 2028 to assess and evaluate advanced treatments and orphan drugs. And the full implementation of the regulation is expected in 2030 for all drugs that are licensed through central procedures via the EMA. Our country is represented through the committee in the newly established Heads of Agencies group, the so-called HAG. It's a group of the HTA committee's heads aimed at preparing the national systems to receive the new European regulation and to have a common field of understanding, common page of understanding. Our country is also represented in UNET HTA 21. It's a consortium of sorts that evolved in 2021. We had the UNETA Action 1, 2, 3, and then the UNETA 21 in 2021, which has as its goal to publish and issue guidelines on methodological and procedural issues in order to support the implementation of the EU regulation and the harmonization thereof in the member states of the EU. I should like to thank you very much for your attention. Thank you very much, Mrs. Bacopoulou, also particularly for the fact that you respected the time allotted to you, which will give us the opportunity to discuss later on. I should now like to give the floor to Professor John Yfantopoulos. Can I have the slides now, please?
Okay, thank you. Thank you. So, start counting time from now. I will try to present you within these 6 minutes that I have to observe 2 questions. The first question is, was it necessary to introduce HTA in Greece? Why should it be here? And the second question, HTA post-era, what will happen? Because we've already seen from the previous speaker the huge work done. Ever since 2018, we had already published our concerns proving the need for an HTA in our country. And it was interesting that in those 2 articles that were broadly aired abroad, we register what is HTA, what is the role of the EOF, what is the role of the Ministry of Health, and what is the role of EOP. Within this diagram, we had given succinctly what are the procedures and the processes for the operation of HTA in our country. Allow me to focus on the very hot topic of pricing. Let us see how pricing was shaped in our country from 2001 to 2019. That the HTA organization was established. What happens? Here we see the weight harmonized prices for medicines, fully harmonized index. Mr. Kostas Athanasakis will tell us we leave the technicalities outside. So what do we see? And it is worth exploring. We see the European Union as it evolves. Poland, again, ascending trend. And here's our country with the yellow line. See from the average of the European Union how disparate were the prices. And see the abrupt drop, equally abrupt ascent, and the gradual final shaping. So we can clearly distinct 2 periods. The first period before, when our country was uncharted waters, divergent from any form of Europe, and then from 2014 and onwards with the MOUs and so forth, how converging is our country vis-à-vis the other European Union countries. making an analysis from 2001 to 2019, we see Poland somewhere in average, Romania the same. We took those two countries because they've got the lowest prices in the basket we use, in the basket of reference, and Greece is the highest. What is interesting, however, in Greece, to see the great differentiation. And in this diagram, the lead diagram, we can see the differences. We can see the differences in the impressionism at the same time. Where is that? Take the x-axis, the horizontal one. Here is the European Union, and here is the trend, an evolutionary trend in all European Union countries around the average. Poland is similar to the EU average, Romania with some problems, and then a similar trend. Oh, our dear country, chaos, total disparity. We go on, seeing how this same line is transposed into indices. So in indices, when seeing the indices, we see that the European Union has a consistency in time, statistical consistency, then follows Poland with an excellent synergy with the European Union. Same for Romania, but more or less statistical difference, which is insignificant, and Greece, negative. What does this mean? Statistically important deviation. Of all the European Union countries, our country was the divergent par excellence. Europe would move positively, we would go on to the negative, the opposite direction. And now let us see today and tomorrow and see what are the possible assessment methods. Let us distinguish in two categories, the clinical one and the financial one. Let us compare those two and see how we assess the value and how we assess cost efficiency. And the academia, Mr. Athanasakis, Madam Pavi, and all the others who are somewhere here offering to offer knowledge and a plethora of data. In continuation of the previous panel, the answer, give me data, and I can measure everything. This we can prove. Two more slides. How we should wonder about the future, and what should we assess, and where do we put the emphasis from now on? First of all, we should be based on medicine, or the clinical dimension, and efficient therapeutical results. No. Should we accept the studies from abroad as imported by companies without seeing the Hellenic particularity? Should we base solely on budget impact analysis and cost effectiveness analysis, or with a broader discussion? How reliable are the epidemiological data offering knowledge? Attica said and has presented us. Same with EOP. But I never heard the word university or academia, and I have all here people present who are researchers, who are hungry researchers and ready to devour any data available. The use of medication, what is it? What's the element of cost in real structures of the health system? Not the DRGs that we are using, which are theoretical, that include only 20% of the real cost, because 80% that has to do with the personnel payroll is not included. Real cost data. What is the notion of value, and how this concept of value, does not coincide with the price of the medication? And finally, what is the value of assessment? And I conclude with this slide. Germany, the UK, the whole negotiation and pricing is based and is in your hands, Madam President, on the basis of the so-called value-based pricing. What does this mean? That means that prices are determined on the basis of the value. It's not economics and accounting, it's a value science. And there, the budget that you use currently is a secondary factor. And at the end of the day, what do we have in these models? The effectiveness cost is a criterion, and Mr. Athanasakis will dwell on the subject. It is a multifactorial analysis so as to make the appropriate decisions. thank you for your attendance and right on time.
Thank you so much, Professor Yfantopoulos. You're notorious for being precise. I should now like to invite Mr. Kostas Athanasakis. Mr. Athanasakis, which do you feel are the most important developments in the health technology assessment in the European environment today? Of course, in relation to Greece. Thank you very much for the question. Now, I should say that last time we found ourselves together with Yannis Yfantopoulos, I promised myself that next time I will set it as a term that I will not speak after Yannis Yfantopoulos. Well, I forgot about it, and this is what happened, you see. Well, you were torrentious once again. And it's not the first time, it's not by accident. So, if you please, Mr. Chairman, if you invite me again, please remind me not to step on the same puddle of mud. Right, so I will try to say something that might inspire the audience in this very late time. Now, if one could distinguish and separate, rather, the developments in two fields. Regarding the regulatory field, it's what Mrs. Bacopoulou mentioned. The key regulatory change right now, it's the joint European regulation that was passed after a lot of woe. Europe says it delayed for 2 years due to the pandemic. Well, things are not exactly like that, because there were 2 years delay because there were huge reactions when the text got to the national representations. It had a lot of problems. I had given the opportunity to see it at some point. What was published compared to what was the object of the deliberations by the committee in the previous years was definitely very different. However, one should say that the changes are not simply something that has regulatory extensions. The changes in the European regulation are something that dates back 20 years from the Joint Action 2, the Joint Action 2. You remember, Madam Dean, the contribution, your contribution there as well, up to and including the changes in legislation. And as of 2011, it went through hell until it reached this point. But in essence, what it does is not simply a regulatory change. It performs a change that is based on the core of health technology assessment. What it tries to do is to get the application to work faster, to bring these applications to those who need them, and of course to allow, because I think this is classic in European policies, to leave the final decision with the member states. This leaving is not entirely innocent. It's not, oh, fine, okay, we've done the work, it's your decision because it's your instruments. It has to do with what Yannis Yfantopoulos said earlier, Professor. The fact that many elements from the assessment, and primarily those of the financial evaluation, are not transferable. What is not transferable is also value systems, the non-countable, non-measurable issues, what we call the value bases in the system. Now, regarding the scientific part, which is the second pillar, if we can say a few things about that as well. Speaking, wearing my cap as associate editor in the journal. Now, the most hot thing in evaluations and assessments is deliberative processes that have been mobilized very much in international literature. We see them primarily doing that, and I believe it is due to the attempt made by the HDAI with this society over the past few years and the 2021 publication as to how the deliberation consultation processes need to be performed in health technology assessment. It is a marvelous paper, truly a marvelous paper, because not only does it say and describe the elements of such deliberations, it also places the actors and the fields this deliberation needs to be made as such. Those of you who are interested in those democratic procedures, I suggest you read it. I suggest I stop here and we can pick up where I left off later on. Right, Mr. Athanasakis, thank you very much for keeping up with the type. Professor Yfantopoulos, Mr. Athanasakis spoke of the importance of consultation and deliberations. Do you believe that in Greece we have such consultation procedures, and what would it take for us to acquire consultation culture, not just for technology, but for health technology? Now I will pick up the torch and the hot potato as well. What happens in Greece and what happens abroad? Now, consultation and deliberations means that there are data, facts. And consultation has 3 stages that we need to take into consideration. The first one is the price. The second is volume, which part of the market we're addressing. And the third and most important part of the consultation, which is not discussed currently, is the one management tree agreement, is the pay-per performance. I mean, how good is the drug? What are the results? And depending on the results, we will make the decisions. And good companies that are truly innovative ones do not want to deliberate and make consultations on the price under conditions of clawback and rebate, which is sort of a haggling situation. Now, we performed a recent study on clawback and rebates that will span to 2030. If the current situation continues to 2030, there will be no more companies, because the burden is huge to shoulder. The states may utilize other funds. So deliberation and consultation means a bilateral relationship that is evidence-based, which means that we have data from the AOP and the Attica data on the table. We have the clinical protocols, and on the basis of those, they say that we'll need to find something that will reduce hospitalization, that will increase the quality of life, and presto, there's the study. The one that is not something that is real in Britain or something that happens in the United States of America or whatever. So the researchers are there, the finger pressed against the trigger, and we're ready to work with Madam President and her team. That is doing great work. And tomorrow, to see our country not in terms of prices, clawback and rebate, or in volume, but pay per performance. If there's a good drug, I will reimbursement. If the drug is not good, I will abolish it.
Okay, thank you. Since you turned your look to Madam Bacopoulou, I will also give her the floor for a question. You showed us the work of the committee and the whole productivity that you have shown and how you proceed. What would you expect? What you wish the state to offer so as to be even more effective and productive in your work? What kind of assistance would you wish for? Mr. Yfantopoulos spoke of the assistance you may have from researchers, but I speak about institutional assistance. And how do you view the future of HTA and your committee in Greece? Well, the cooperation with scientific societies is very important. And this is precisely how we proposed and had the change institutional framework. And now we can select external auditors from the academia. This was non-existent before our committee was established. This has greatly facilitated our task, and there's a huge field for cooperation that can be discussed. What I see in view of the European regulation is that we must boost HTA through people who will be permanent employees, permanent staff. And this is extremely important for the secretariat, the scientific secretariat, because as things will evolve the next years, the cancer, that is the medicine that is being assessed, we will submit the whole file centrally. So we should have the appropriate secretariat that will be able to enter the European platform and retrieve all the documents, because the documents will not be refiled at national level. And the joint clinical assessment report is most important. That would be a report where all the views and divergent and counter arguments will be registered, but there will be no conclusion drawn. This was voted and adopted in the European regulation. So you realize that the national state will still exist. It will be necessary The drugs that are to be assessed the next year will be very few. We start from 2025, and the first year there will be only one medicine to be assessed. So there will be, we will not have the national HTA vanishing, but the role of the scientific secretariat will be decisive. We must have the appropriate people, and we only have excellent scientists who must have a more permanent work relation, so as to perform this task that we will demand access to central data banks and will be most useful and of critical importance. So a transition from a committee to a body, you mean an agency, the way you describe it. Well, that would be ideal. I don't know what's the capacity for that, but if this cannot be implemented in the first stage, what should be done, I believe, would be to have the secretariat staffed, or for the current people to have a more permanent relation, because there are people who have acquired useful experience, they know and love this work. So it will be extremely helpful if they remain, because they will be necessary. The alternation of people in these posts does not help, especially when these people have proven their value. Thank you. I hope that the state pays heed to that and listens to your claim. I'd like to address a question to Mr. Athanasakis. Mr. Athanasakis, we saw that in order for the HTA to proceed in Greece, what is most important is to have the appropriate personnel with the appropriate knowledge. How do you view this capacity building that we should have in Greece so as to reach the point to be effective and have a real operative HTA in Greece as well? This is a very interesting query, and thank you for raising it. In the first years when we started discussing about HTA in Greece, and then I do not refer to this grant link originally. I say when we really entered into the gist of the matter, the first issue was whether we would have people supporting this subject. Well, people are always available, to be honest. Professor Yfantopoulos has hundreds, if not thousands, of university degree holders from the public health school. There are 3,700 alumni from this program solely. So critical mass was always there. The point is that this critical mass has to be continuously trained and retrained so as to respond to the ever-changing needs and demands. For instance, the way we assess currently things in 2022 has nothing to do with what happened in 2012 or in 2002. And there's no relation the way we perceive the so-called system of values and how it was introduced in the normative parts of the decision has nothing to do with the similar regime of the past where it was practically non-existent. Therefore, we need a training that will respond to these needs. For instance, I'm telling you, next week, a pan-European meeting takes place in Salzburg. All the subject of HTA, supported by Ansford, the University of Maastricht, and the European Medical Institute. I will be a speaker there, having the closing speech. On the subject, as Madam Bacopoulou has mentioned, I will be speaking of the procedures of European integration in the HTA field. These people will be training that personnel that will go there for a whole week, only on the issues of financial assessment. You realize how big are the demands and how far we should reach. We do have the personnel. The point is, how are we up to date? And at this point, the work to be effected by universities must be abundant and continuous. Thank you. I would like to thank you all. I see that there's no more time available, so we should conclude here. In concluding, I would like once again to reiterate what I always say, how important I personally consider in HTA to have the participation of all the stakeholders. I consider that this is most important, especially for the demonstration of the value and so as to cover all domains of HTA. I warmly thank you, the panelists, and you who attended this session.